6:13, welcome back. A senior in Northwest San Antonio got a letter that said her medical provider could no longer provide health care services to all patients, and they would not be her primary care provider after 60 days. Well, the woman says she couldn't get a straight answer on what exactly was happening with her care, so she finally called KENS 5. Our Andrew Moore got right to finding out whether she still was a patient.
Brenda Stuhldreher says she's been going to Gonzaga Medical Group for the last 10 years. So when she got a letter that stated they could not serve all their current patients, she was upset. Furthermore, she didn't actually know if she was still a patient even after calling them. So KENS 5 contacted Gonzaga to find out what was going on.
I was very upset. I didn't know what I was going to do.
Gonzaga Medical sent Brenda Stuhldreher a letter saying they can no longer serve all patients, and then it says in bold, after July 1st, GMG will no longer serve as your primary care provider. The senior says it was scary at first.
I'm trying to think, how do I get care?
But in the very next paragraph, it also said GMG has developed an alternative primary care service for you, and it says she needed to opt in by calling them. Stuhldreher says she called Gonzaga the same day she got the letter, and then she drove to their Culebra location in person, but she still could not get an answer.
I got the patient advocate, and she had never seen it. Appeared that she had never seen the letter because she looked a little startled.
Finally, she called KENS 5.
Nobody explained to me what was going on.
KENS 5 then reviewed the letter, and we observed as she called Gonzaga Medical Group again.
So am I being let go?
During that call, a representative told her she could remain as a patient at Gonzaga after July, but she would be served by a pool of available doctors instead of her current primary doctor. KENS 5 then contacted Gonzaga Medical Group directly and asked them to confirm if this was correct. Gonzaga Medical Group sent a response the next day that said, in part, the letter Ms. Stuhldreher received was intended to communicate a change in physician assignment, not a loss of access to care. Ms. Brenda Stuhldreher remains an active patient with Gonzaga Medical Group and is not being discharged from our practice.
That's all I was trying to find out from beginning to end.
Gonzaga also gave Stuhldreher a call to reassure her as well. The senior says she's relieved it got cleared up, and she's glad she called KENS 5.
Now I have the information that will let me find out what way I want to go.
And Gonzaga Medical Group also told us they understand that that letter and subsequent conversations did cause frustration and confusion. They said that they are going to more clearly communicate about patient care changes moving forward. For Call KENS, Andrew Moore, KENS 5.
Hey, when problems come up and you can't get them resolved, be sure to call KENS. The number is right there on your screen, 210-470-KENS. Make sure to leave a detailed message with your name, phone number, and the issue. We'll see what we can do to help. Paul?